You've spent 10 years saving every penny, skipping vacations, and building your dream. But did you know a single night in a US hospital can take it all away? I'm talking about $50,000, $100,000, or more, wiping out a decade of hard work in just 24 hours. Most Americans think their insurance covers everything. They're wrong. In this video, I'm showing you the hidden traps in the US healthcare system and, more importantly, the 3 steps you must take right now to protect your savings from medical bankruptcy. Let's dive in. This isn't a rare story. It happens to people with jobs, with health insurance, with savings accounts, people who did everything right. And the terrifying part? Most of them never saw it coming. Because the threat wasn't the illness. It was the bill that showed up 3 weeks later. Meet Marcus. 34 years old. Marketing manager in Columbus, Ohio. Pays $420 a month for health insurance through his job. Has a decent emergency fund, about $18,000 saved up over a decade of discipline. Marcus thought he was covered. Then he woke up one morning with chest pains. Went to the ER. Spent 2 nights in the hospital. Tests, scans, monitoring, the whole thing. Turned out to be a stress-related arrhythmia. Not life-threatening. Totally treatable. He went home relieved. Then the bills started arriving. First one, $4,200. Okay, manageable. Second one, $9,800. From a specialist he didn't even choose. Third one, $6,100. From an anesthesiologist who was apparently out of network, even though the hospital itself was in network. Total? Just over $20,000. After insurance. In 2 nights. Marcus didn't have bad insurance. He had normal insurance in America. And that's exactly the problem. Here's where it gets worse. Most people believe that having insurance means they're protected. And technically, they're right. Insurance does protect you, just not the way you think. There's your deductible. The amount you pay before insurance kicks in at all. Then there's coinsurance. Even after you hit your deductible, you're often still paying 20, 30, sometimes 40% of every bill. Then there's the out-of-pocket maximum. Which sounds like a safety net until you realize it can be $8,000, $9,000, even $14,000 for a family plan. And that's assuming every single provider you saw was in network. Which, in an emergency, is almost impossible to guarantee. Because when you're in an ambulance, you're not shopping for doctors. The system isn't broken. It was designed this way. And this is the part nobody talks about. Even after you get the bill, you can fight it. Most Americans don't know this. They see the number, panic, and either drain their savings or start making payment arrangements immediately. But hospital bills are negotiable. Almost always. Hospitals have something called a charge-master rate, basically a made-up inflated price that almost nobody actually pays. Insurance companies negotiate it down. If you're paying out of pocket or you're uninsured, you can negotiate it down too. In fact, non-profit hospitals, which account for about 60% of all hospitals in the US, are legally required to have financial assistance programs. Required. By law. But they don't advertise it. If your income falls below a certain threshold, you may qualify for significant bill reductions, sometimes down to 0. Even if you have insurance. Even if you have savings. Marcus found this out after spending 3 weeks stressed out of his mind. He called the hospital's billing department, asked specifically about financial hardship programs, and got $11,000 knocked off his bill. Just by asking. If you're still watching, this next part changes everything. Because we've been talking about what happens after the bill arrives. But the real damage? It starts way before that. Here's what nobody tells you about emergency funds. Most financial advice says, save 3 to 6 months of expenses. And that's solid advice. But almost nobody tells you where to save it, or how to make sure it actually covers a medical emergency. Because a standard savings account sitting at 0.1% interest isn't a plan. It's a waiting room. The real issue isn't that people don't save. It's that they save for the wrong emergencies. You're saving for a car repair, a busted furnace, a roof leak. But a medical emergency doesn't cost $1,200. It costs $14,000. Or $40,000. Or more. And the gap between what people save and what a real health crisis costs? That gap is where financial lives get destroyed. So what does a smarter setup actually look like? Here's how people who don't get wiped out think about it. Bucket 1, the HSA. A health savings account is one of the most underused financial tools in the country. It's triple tax advantaged, meaning contributions go in pre-tax, it grows tax-free, and you withdraw it tax-free for medical expenses. In 2025, individuals can contribute up to $4,300. Families up to $8,550. And here's the part that blows people's minds, you can invest your HSA. It's not just a savings account. It can grow like a retirement account, specifically for healthcare costs. Bucket 2, a true medical emergency fund. Separate from your regular emergency fund. Specifically built to cover your out-of-pocket maximum. Whatever your plan's cap is, $7,000, $9,000, that number should be sitting somewhere liquid and accessible. Bucket 3, know your rights. Before you ever set foot in a hospital for a non-emergency procedure, get a good faith estimate in writing. Under the No Surprises Act, passed in 2022, providers are required to give you one. And if your bill comes in higher than the estimate by more than $400, you can dispute it. These aren't hacks. They are not loopholes. They're rules that already exist. You just have to know they're there. Marcus spent 3 weeks convinced his savings were gone. He'd built that cushion over 10 years. Skipped vacations. Drove the same car. Made smart choices. And he almost handed all of it to a billing department without question. But he asked. He negotiated. He applied for the financial assistance program. And then he restructured. He opened an HSA. Started contributing monthly. Set aside a separate account just for medical emergencies, enough to cover his out-of-pocket max. He didn't change his income. He changed his system. Here's what I want you to walk away with. The American healthcare system is not designed to make this easy. And that's not your fault. But knowing how the system works, that's your advantage. 2 things you can do this week. 1. Look up your plan's out-of-pocket maximum. Right now. That's the real number you need in a liquid account. 2. If your employer offers an HSA-eligible plan, open one. Even if you only put in $50 a month. Start the clock on that triple tax advantage. You can't control when something goes wrong. But you can control whether it destroys you financially when it does. The bill was never the real threat. Not knowing you had options, that's what wiped people out. Now you know.